As Israel lifts its mask mandate and COVID cases rise in some parts of the world, a first-of-its-kind study has now shown that COVID patients with a serious psychiatric record have double the risk of death. The peer-reviewed research has been published in the Molecular Psychology Journal. The study looked at the anonymous medical records of every Israeli over the age of 18 who has been hospitalized for a psychiatric reason. For more on this, take a look at this exclusive interview between WION's Jody Cohen and Professor Mark Weiser, Director of the Psychiatric Division at the Sheba Medical Center and the lead researcher of the study in Israel.
Thank you, Professor Weiser, for speaking with WION. Now, your study suggests some alarming implications for people with severe psychiatric illness. What more can you tell us about what you found in your study?
Yes, so thanks for having me, Jody. In Israel, there is a central recording of all psychiatric hospitalizations in the country. So we were able to identify anyone who at any time in their lives had been hospitalized in a psychiatric ward or in a psychiatric hospital at any point in their lives. And we were able to see how many of them had COVID-19, how many were hospitalized, and how many were later vaccinated. And what we discovered was that if patients with severe mental illness, most of these patients had schizophrenia, bipolar disorder. These are severe psychiatric patients. If they got corona, they were more than double the risk of being hospitalized and double the risk of dying from the illness. So basically what I understand from this is that having a severe psychiatric illness is a risk factor, just as we consider people who have immune deficiencies or who are older. These are also people who are at increased risk for suffering from problems if they get corona. So people with severe psychiatric illnesses should be considered to be part of this as well.
Why do you think people with severe psychiatric illness are at greater risk from COVID?
So there are several answers to that question, but patients with severe psychiatric illness, again, schizophrenia, bipolar disorder, are at increased risk for almost every illness. Those patients will have higher risks of having cancer, higher risk of having lung disease. Patients are less likely to work out, often don't take their medical medication, hypertensives, antihypertensive, anti-diabetes, et cetera, So this is part of patients with psychiatric illnesses, particularly schizophrenia, having increased risk for medical problems in general.
Isn't it a vicious cycle that we know that COVID is leading to more anxiety and rising mental health issues across the world, and yet your study suggests that people with severe psychiatric illness suffer more from COVID. So how can this cycle be broken?
Okay, so thank you for allowing me to clarify this. These are two separate issues. In the Western world, during the pandemic, there's been large increases in depression and anxiety. People have been isolated for long periods of time. Many didn't go to work. There have been a lot of psychiatric problems related to this. People who have had difficulties or having difficulties related to COVID, anxiety, depression should certainly seek help, and we can help them feel better with psychotherapy, with medications, with combinations. This is a completely separate issue than what I'm talking about now. What I'm talking about now are people with severe psychiatric illnesses. Many of them have schizophrenia, bipolar disorder, who are actually hospitalized in a psychiatric facility, and these are the people who the study addresses. People with milder forms, depression, anxiety, do not have to worry that they're going to have increased rates of hospitalization or death. This is a different population of people.
What are the public health implications of this study, and how will it be taken forward?
There are several public health implications. One is that patients with severe psychiatric illness should be considered a group that is at risk for more severe outcomes if they get COVID-19. The second one has a very practical implication in that patients, and the additional very important finding is that patients with severe psychiatric illness, particularly those with schizophrenia, are less likely to come in and get vaccinated. So what this means is that we should reach out to these patients and find a way, perhaps go to their homes to give them vaccinations, find ways to incentivate them to come in to get vaccinated, because part of the reason that they're having more illness is that they're being vaccinated at a significantly lower rate.
So important public health implications from your study across the world there. Thank you for breaking that down for us, Professor Weiser. This is Jodie Cohn for WION World is One.
WION is now available in your country. Download the app now. Get all the news on the move.